Hello and welcome to the program. My name is Marie Yambo and this is Health and Lifestyle. Our social media handles at Marie Yambo, at KBC Channel 1 on X and KBC Channel 1 TV on Facebook. Coming up in this program.
Kenyatta nikaenda nikapimwa kila kitu, nikatolewa kanyama. Wakasema nikaona wameandika urgent. That means sasa kwa imeenda sana. Na sasa hiyo nikaenda kwa daktari na nikaanza matibabu. Lakini kufika kwa daktari ilikuwa imefika 2B.
Surviving cervical cancer.
When it's caught at the stage of screening, you want to catch it before it has transformed into a cancer at that point. Because at that time, it's easy for you to just cut it out.
Early detection remains the best bet against cervical cancer. Cervical cancer is the second most common type of cancer among women in Kenya, followed by breast cancer. Over 5,000 women are diagnosed with cervical cancer annually in Kenya, and over 3,000 of them lose their lives to the disease. And so, January being the Cervical Cancer Awareness Month, we wanted to focus on the importance of early diagnosis. Monica Njeri was diagnosed with stage 2 cervical cancer. She shares the stigma she faced and the financial challenges therein. An estimated 5,236 women are diagnosed with cervical cancer each year in Kenya, according to data from the Kenya Demographic and Health Survey. The prevalence of cervical cancer screening and awareness was also found to be low, a matter that puts women like Monica Njeri at risk of cervical cancer.
Nilikuwa naisikia tu. Nilikuwa nasikia na watu wakisema wanaenda kupimwa. Na nilikuwa nasikia tu watu wakisema mwingine ako na kansa, lakini mimi kwangu sikudhani, sikuchukulia maanani. Sikufikiria mimi naweza nikaenda kupimwa, sababu mimi nilikuwa naona tu wale wako na hizo vitu ni wale watu wako na laana.
Cervical cancer is transmitted sexually through the human papilloma virus HPV. The first stages of cervical cancer is typically painless and takes around 10 years or more for cervical cancer to develop. That's why screening is so important.
Mara mingi hata nilikuwa nafikiri ati niko healthy. Sasa niko na hiyo miaka niko nao na ninapata period, mimi niko healthy. Lakini nilifika mahali nikaona hapana, inakaa tena inaenda inakuja tena kuja kama siku 7. Nikaona sasa hii bleeding imekuwa too much. Na pia odoment pia ilikuwa inaniuma tena sana na mgongo. Sasa hapo ndio nilifikiria niende nikapimwe.
The progression from HPV infection to fully blown cancer often takes 10 and 20 years in most cases. The time frame, however, can be shorter in individuals with weakened immune systems.
Nilifuatilia kwa mahospitali mingi sana. Lakini kila hospitali nikienda, mara wananiambia result hazijatokea, unapata miezi 3 zimefika result haijatokea. Mara mwingine anaona lakini anaogopa kukuambia. Anakuambia enda ununue dawa huko nje. Mwingine anaangalia akiona anaenda anaita daktari mwingine. Sasa ikafika mahali pia hata mimi kaza kuniogofya. Nikamwambia kama iko mnaniambia iko, lakini sikupata kuniambia hadi dakika ya mwisho. Nilikutana na daktari mmoja anaitwa Dr. Yeni. Yeye ndiye alikubali kuniambia. Na kwa wakati huo sikustuka saa hiyo. Lakini wakati nilikuja kwa nyumba nilikana nikajiuliza maswali mingi sana. Na nililia sana sababu nilikuwa naona ni kama nimefika mwisho. Hata nilikuwa nauliza Mungu why me. Lakini nilifika mahali nikajiuliza sasa kama sio mimi ni nani? Sasa ndio nikaanza kufuatilia matibabu.
Although she faced financial challenges in seeking treatment, early diagnosis prevents cervical cancer from spreading.
Mimi niligundua ikuwa kama stage 1. 2019 ndio nikaenda mother child. Mother child sasa nikaenda nikaona yule daktari mkubwa, kuna ile siku gynecology alikuwa anapatikana. Ndio nikaenda naye akanituma Kenyatta. Kenyatta nikaenda nikapimwa kila kitu, nikatolewa kanyama. Wakasema nikaona wameandika urgent. That means sasa kwa imeenda sana. Nikaandikwa urgent. Na sasa hiyo nikaenda kwa daktari na nikaanza matibabu. Lakini kufika kwa daktari ilikuwa imefika 2B. Sasa mimi kwangu naweza nikasema hata kwenda mapema ilinisaidia.
Monica credits her family's support that gave her the strength to overcome. However, stigma and discrimination remains the hardest to deal with among those diagnosed with cervical cancer.
Kuna pale nilikuwa ninaishi, unaona kama ni choo unaenda na watu wanajua wewe uko na kansa, hiyo choo hawezi ingia. Sasa unaona watu wanaenda wanaambia landlord, sisi kama huyu atakaa hapa itabidi sisi tuhame. Unaona? Sasa inabidi sasa wewe sababu ndio mwepesi unafanya nini? Unahama. Kitu ya kwanza mimi nilijikubali na nikakubali ni kweli niko na saratani. Kwa hivyo ikifika ni mambo ya mtu, mimi nikiona unanibagua, mimi ndio ninakuondokea. Lakini baya ni baya, nitakuface. Nikwambie hii kitu hata mimi sikuzaliwa nayo. Nimekuja nikajipata. So the best thing hata uende kufanya nini? Uende ukapimwe. Na kwa hiyo hali watu wengi wameenda wakapimwa. Na hao watu walikuwa na kubagua, sasa ndio wanaanza kukutafuta.
Early detection, she says, is the key to ensuring no woman suffers the shame and suffering she experienced.
Mimi kwa saa hii vile nilijua mapema, kansa yangu haiko. Na siti yangu sabuilisha. Nimefanya mpaka pap smear. Nimefanya PET scan. PET scan pia imesema sina. Na kuambia hata kupatikana ati uko na saratani si ati ndio mwisho wa maisha. Maisha lazima itaendelea. Ujulikane mapema, utibiwe mapema. Na ukipatikana uko nao tutafute. Sisi tunakuwa Kariobangi, Symbol of Hope. Tuko pale, tunaweza kutembea pamoja. Kama hauna pia ni vizuri. Jaribu kuelezea mpaka wale watu wengine.
Indeed, just as Monica has already shared, early detection remains the best bet against cervical cancer. But awareness also plays a key role, and so on Word on the Street, we just wanted to gauge the opinion of the public on their awareness as far as cervical cancer is concerned. Let's take a listen.
What I know about cervical cancer, I know it's a type of cancer among the many cancer types we have that affect women, and it occurs at the cervix. I know it can be, when it's detected early, it can be treated, but if it's detected on late stages, it can be also deadly, but there's always hope.
It probably develops from HPV, which you need to be screened for. Could be because you're having too many partners, so you need to be very, very careful. There's need to make sure that you're having one partner and you're well aware. Go for the screening, and yeah, that's basically it for now.
Cervical cancer has been an endemic disease in our country, which mostly affects women at old age. And I've seen a patient with cervical cancer at stage 4 of the disease, and it is devastating.
It's a type of cancer that occurs in the cells of the cervix, and it is in the lower part of the uterus.
Cervical cancer, I can say, is pain during urination, the pelvic pain, especially during menstruation or after menopause.
On that note, we take a break, but we'll be back with more on cervical cancer. Welcome back, and thank you for staying with us. Now, it takes between 10 to 20 years for cervical cancer to be fully blown. Dr. Jonathan Wawire is an anatomic pathologist. He begins by explaining the benefits of early detection of cervical cancer.
Cancer of the cervix is unique in a couple of respects. One is that the patients are predominantly younger than what you expect in other types of cancer. Secondly, it's in a fairly easily accessible location, so catching it shouldn't be that difficult, or rather it's easier to catch it than it is to catch other malignancies. So for example, colon or other internal organs that you have to do imaging and such like things. And then thirdly, cancer of the cervix, from the time that a patient or a potential patient gets an infection of HPV, the virus that is known to lead to cancer of the cervix, to the time they actually develop cancer of the cervix, you have a long window, a long time that you can keep screening this particular woman to be able to catch it early. So it gives you quite a good enough opportunity for you to catch it and intervene in good time.
So essentially what you're saying is that if you get it early, then the chances of treatment are also high. It's successful. So talk to us about the importance, or what's the difference, if I may put it, in terms of catching it early and late when it comes to treatment?
So the thing with cancer of the cervix, and I'll take you back slightly. So by the time we're talking about stage 1, 2, 3, and 4, you're talking about cancer already. By cancer, you mean it has the cells have been transformed, and they have also invaded the basement membrane, which we mentioned is like the floor on which the cells sit. So the thing about cancer of the cervix is that you want to catch it before it's even stage 1. You want to catch it before it's being pronounced as stage 1. So that means when it is caught at the stage of screening, you want to catch it before it has transformed into a cancer at that point. Because at that time, it's easy for you to just cut it out. The treatment becomes very straightforward. You remove the area that is diseased, and the patient is just followed up going on forward. So you've actually prevented it from developing into cancer. But should you be unfortunate enough to detect cancer now, that you detect the malignancy after it has already formed, it's no longer a precancer, then at that point is when we start now looking at which stage it is. So at that point, they have to look at, do some imaging to see how far it's extending, how big the tumor is, has it involved any lymph nodes in the region, has it spread beyond the pelvis and into other organs. And then from then on, they can work out what treatment is appropriate for that patient. But what I'd like to emphasize is that the best, the best outcomes for cancer of the cervix or malignant lesions of the cervix are achieved when detection is done before the cancer has actually developed. And that is where the emphasis on screening is put, because screening makes the biggest difference for patients who might develop cancer of the cervix. Cancer of the cervix will develop after a long-lasting infection of human papillomavirus. There are certain types of human papillomavirus when they infect parts of the cervix, they can persist. And they have a high risk of transforming the cells in the cervix from what they usually are, benign, to malignant cells. Malignant cells meaning they are no longer under the control of the usual cell cycle. So they do not divide when they are supposed to. They divide on their own. And that is what essentially cancer becomes. It's a runaway proliferation of cells that invade and go everywhere. So HPV, women usually catch it early, from the time they have their sexual debuts. Most of them will be in the late teens, early 20s. But as they go through their mid-20s towards the late 20s, their bodies, their immune systems are able to clear the virus from the body. But a few of them have the virus persist. And if it persists for another couple of years, you're talking about 3, 4, 5, 6, even 10 years, then the risk of it transforming the cells within the cervix is higher. And that's when they're more likely now to develop these precancerous lesions that end up leading to cancer of the cervix. So talking about cancer of the cervix and HPV in the same breath really helps, because it helps us link what causes it. That's the HPV virus, and all the changes that happen before it actually develops into cancer. So when we say screening, we are looking for presence of HPV as well as presence of the effects of HPV on the cells. So we want to catch either HPV when it's still there, and then we know what to do with that patient. If they have persistent HPV infection, we can look at them, we can follow them up more closely. And if the HPV has actually transformed the cells, then we can act at that point, depending on the risk that these cells that have been transformed will develop into a cancer. So that is the essence, the rationale behind the screening methods that we have currently. So the essence of catching it early again is so that the interventions can be done At that point, the interventions that need to be done are very small, if I can put it that way. Most of it is just excision. You excise that small little bit of abnormal cells and then follow up the patient from then on. But if you catch it late, which means that cancer has already invaded and spread beyond the confines of the cervix, then it becomes a bit more complicated. If it's surgery, the surgery has to be more extensive. They have to remove more organs. They have to cut away more tissue, which means the recovery of the patient is going to be more difficult. And also the likelihood that everything that contains cancer has been removed is also lower as the tumor grows bigger. So the essence of screening is that if you find an abnormal pap smear, for example, you can go back and just excise the area of the cervix that seems to be affected. And then the patient should be fine going on forward. Some of the procedures can be done, as you mentioned, as a day case. You come in, you have the procedure, and you go back home. In some places where they are not even doing pap smears or HPV testing, they just visually inspect with iodine, and if there's an abnormal area, it's cut out and the patient is allowed.
Mm-hmm. So, Dr. Ari, I mean, the cervix is the reproductive area of the woman. So, if interfered with, and especially when somebody gets now cervical cancer, would that interfere with their fertility, their ability to bear children?
So the thing is, with cancer of the cervix, and I mentioned particularly because it's one of the cancers that affect younger women, that becomes a consideration. Because, for example, if a patient is in her 30s and she's not completely done with childbearing, having extensive surgery of the uterus, removing the uterus and the ovaries at that point is not a very good option for them. And so early screening, again, allows the doctor to just nick out an area of the cervix that is affected while preserving the fertility of the patient. She can continue to have children going forward. But if cancer is advanced at that stage, if you are to balance the risks of dying from the cancer versus the time you will take to maybe go through childbearing, then most of the time you'll prefer to have surgery to remove the cancer than leave it there so that the patient can undergo childbearing.
So, you know, what we've talked about in terms of, you know, early screening, the advantages of early diagnosis and all that. But that is to do with the patient. But now, if I now I've been encouraged by listening to you, and I now want to take the step and go to a facility, we know that there are very many challenges because those facilities are not as widespread. Most of them are in the urban areas. Could you talk to us about some of the challenges that, you know, within, can I say, the medical field you're facing in terms of ensuring that, you know, patients, or at least those who would want to go for screening, in terms of access?
So we're not, as a country, endowed with resources like it's the case in the West and in places like some parts of Asia. So the current screening methods available are not. So we have those that require the use of a lab, and we have those that don't require the use of a lab. So the ones that don't require the use of a lab are not as specific. In other words, if you use those tests, and I mentioned them earlier, iodine and acetic acid, just the vinegar, that household vinegar, it's applied on the cervix, and then you observe. The challenges with that is that there are many, many things other than cancer of the cervix that can have that abnormal discoloration using iodine. So it's not very specific. So if you are to use that, out of 100 women you will use it on, and you find maybe 60 of them have discolored cervix, maybe only 20 of them actually have something there that is worth cutting out. So you see, you'll have exposed about 40 other women to a procedure that they absolutely did not need.
So essentially what we've also learned in this conversation is that HPV is sexually transmitted. So are you saying that people should actually, you know, use protection? Or at least, I don't know, what method is it? Abstinence, so that you don't get it. But if you're sexually active, what should you do to protect yourself?
So apart from barrier methods and all other, you know, using condoms and having fewer sexual partners if possible, or just one, the best method is actually just vaccination. So at this point, and I mentioned it too earlier, if you have a daughter or a son is allowed, but predominantly daughters for cancer of the cervix, who are below the age of 15 or thereabouts, they should get vaccinated, because the vaccines are available and they prevent all types of cancer that are caused by HPV, not just cancer of the cervix. So it's good enough protection. In countries where vaccination programs have taken off, and they have at least one cohort of women in their adulthood who have been vaccinated, cancer of the cervix is completely gone.
And as always, we give you tips on our good practice today, and we want to focus on some of the early symptoms of cervical cancer and also ways to prevent it. The early symptoms of cervical cancer include vaginal bleeding after intercourse, pelvic pain during intercourse, bleeding after menopause, bleeding between periods or periods that are heavier or longer than normal, discharge that is watery and has a strong odor or that contains blood. Cervical cancer is highly preventable through vaccination and screening. Cervical cancer screening can detect abnormal cells in the cervix before they become cancerous. The HPV vaccine is highly effective at preventing cervical cancer. In Kenya, the HPV vaccine is given to girls between the ages of 10 and 14 years. The vaccine is administered in 2 doses, 6 months apart, at government facilities that offer routine immunization for children. Practice safe sex against the sexually transmitted human papillomavirus, HPV. And finally, adopt a healthy lifestyle. We've come to the end of the program. On behalf of everyone who made this program possible, the production team, and of course, Dr. Jonathan Wawire and also Monica Njeri for sharing their insights in as far as cervical cancer is concerned, and of course you for sharing your opinion and also taking the time to tune into the program. My name is Marie Yambo, and if you've missed any part of this program, remember you can also check it out on our YouTube channel. Our social media handles at Mariambo, at KBC Channel 1 on X, and KBC Channel 1 TV on Facebook.